on cardiac tumors. In general, tumors that involve the heart are relatively rare, especially compared to other organ systems. In this video, we'll talk about cardiac myxomas, which are the most common primary cardiac tumor. I'll also discuss rhabdomyomas, which are the most common primary cardiac tumor in children. And then finally, I just want to mention that metastatic tumors to the heart are the most common tumors in the heart overall. These usually do not cause clinical symptoms, and they're often identified post-mortem, but they do occur with greater frequency than any of the primary tumors in the heart. Shown on the screen is a transesophageal image of a cardiac myxoma. This black chamber here is the right atrium. This line is the septum between the right atrium and the left ventricle. Right here, where I'm showing with my pointer, is the left atrium, and you can see that there is a mass that is attached to the interatrial septum that is mobile and moving around in the left atrium. That is a cardiac myxoma. Myxomas usually occur in the atria of the heart. They are common in the left atrium. About 80% of myxomas occur in the left atrium. Less commonly, they arise in the right atrium. They are usually attached to the atrial septum, just like that moving image we saw in the last slide, and they often attach at the border of the fossa ovalis. And myxomas are benign tumors, meaning that they do not metastasize to other tissues and organs. Myxomas are made up of a number of different elements. They contain undifferentiated cells called mesenchymal cells. They also contain endothelial cells. In addition, they usually have thrombus and clot present. And then finally, they contain sticky molecules called mucopolysaccharides. And these things all come together to form that mobile mass you saw in the moving image 2 slides ago. Patients who develop myxomas often have systemic symptoms, which are called B symptoms. These are symptoms like fevers, chills, and sweats. In addition, a piece of that mobile myxoma can break off and embolize and cause a stroke, so one of the risks among patients who have myxomas is that they may develop a stroke. I told you before that myxomas commonly arise in the left atrium, and if they are big enough and mobile enough, they can potentially disrupt mitral valve function. They can interfere with the closure of the mitral valve leaflets, and this can lead to mitral regurgitation and potentially heart failure symptoms. In addition, myxomas can sometimes sit in the mitral valve. This is called a ball-in-valve phenomena. This will obstruct flow across the mitral valve and lead to mitral stenosis symptoms. Rarely, this can even lead to syncope or sudden death. So the classic scenario for a board question is to describe a patient that dies suddenly and at autopsy is found to have a myxoma. If you're asked about the mechanism of death, it was likely obstruction of the mitral valve via this ball-in-valve phenomena. And then finally, sometimes patients with myxoma have a particular oscillatory finding you can hear with your stethoscope. This is called the diastolic tumor plop. Moving on, let's talk about rhabdomyomas. These are tumors of muscle cells. Just like cardiac myxomas, these are benign tumors, meaning they do not metastasize. They usually occur in children, usually in children under 1 year of age. They are sometimes detected prenatally. Most women have prenatal ultrasounds, and you can see the heart of the fetus, and sometimes you can see one of these masses in the baby. It will appear on an ultrasound image as a mass or tumor embedded in the ventricular wall. Most of these tumors regress spontaneously and require no treatment. Very rarely they can cause symptoms, and when they do, it's usually from obstruction of blood flow. Here's an ultrasound of a child with a rhabdomyoma. Note this mass in the middle of the left ventricle. You can also see masses embedded in the wall of the ventricle. Usually there are multiple masses found in a child. And remember that the other common cardiac tumor, a myxoma, usually does not involve the ventricle. It occurs in the atria. Under the microscope, what you see in rhabdomyoma are myocytes. These are not malignant cells, they're myocytes, but they're enlarged and disorganized. That's what's shown in this slide. The pink material represents myocytes. There's lots of clear cytoplasm, which is an abnormal finding. And then another classic finding is called a spider cell, one shown here. What happens is this wispy material connects from the nucleus out to the periphery of the cell, and it looks like a spider. What you want to know about cardiac rhabdomyomas for the USMLE Step 1 exam is that 90% of these tumors are associated with tuberous sclerosis. Tuberous sclerosis is an autosomal dominant genetic syndrome. It's caused by mutations in either the TSC1 or TSC2 gene. The TSC1 gene codes for a protein called hamartin. The TSC2 gene codes for a protein called tuberin. And mutations in either of these genes leads to widespread tumor formation, including the formation of rhabdomyomas in the heart. Tuberous sclerosis involves multiple organ systems, not just the heart. In many different organs in the body, hamartomas and other neoplasms will form. Neoplasms can form in the central nervous system, and this can lead to seizures, and this is the most common presenting feature of this condition. It's usually going to be a child who presents with seizures. In addition to seizures, other characteristic findings are the presence of ash leaf spots. These are pale hypopigmented skin lesions. I'll show you a picture of one of these in a minute. In addition, these children often have facial skin spots called angiofibromas, and finally, there's often mental retardation. So the typical presentation is for a child to come to the doctor for seizures and then some of these other features to be present. That suggests tuberous sclerosis. This is a picture of a child with angiofibromas. They are often present in the nose and malar regions of the face, just like in this image. And then this is a picture of an ash leaf spot. It's a pale hypopigmented spot seen on the skin. And that concludes our video on cardiac tumors.